Body Dysmorphic Disorder, or BDD, is a disorder in which people become extremely preoccupied with a perceived flaw in their appearance. They become very bothered that there's something really, really unattractive, ugly, deformed about some aspect of their physical appearance. Some of the most common areas are the skin, the hair, the nose, weight or body shape, the stomach, but it could really be any part of the body. People think there's just something weird about the way their body looks, and they're very bothered that other people are noticing this a lot and often judging them for it. And so because of this fear, people will do all sorts of things to try and avoid it. The most obvious one is just simple avoidances. If I'm really terrified that my face is covered in horrible scars or disgusting acne, then it kind of makes sense that I would be reluctant to go to a party where a bunch of people are going to see my face, and then in my mind they're going to judge me for it. So people may avoid socializing. They may even avoid going to work if there's other people there. Even seeing close friends could be a challenge for many people. Another form of avoidance is sort of compensatory behaviors, where people try to cover up the perceived flaw. Maybe I will go to the party, but only if I can wear a hat, and I want a hat that I think is going to kind of block maybe the worst part of my face, like my forehead. Or maybe I'll wear sunglasses inside if I think that'll kind of make my nose look smaller. All sorts of things to try to compensate for this flaw. And then you also see a tremendous amount of reassurance seeking in BDD, where people are going to ask people they trust, what do you think? If you just met me, would you notice how deformed my face is? Or if you met me at a party, would you think, man, that guy looks really bald? And it's sort of these questions of trying to get a sense of how other people see them. People with BDD, because they're isolated, because they're distressed, also tend to be pretty depressed, and they have a lot of social anxiety. These things kind of all go together, making this a pretty difficult disorder to live with.